Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Glad to be here. Today, I'm going to get into talking about self-silencing and the impact self-silencing has in women's health. This is a big part of my practice of medicine, and it's so pervasive in medicine. When you treat women, you can't treat women without coming up against this. As in all things, around women, there's not enough research in it. And I want you to know I'm aware of that. We're going to have citations at the end of the video on YouTube. And I'm going to do a lot of citations with these ones because whenever I feel like I'm talking about something that is going to be profoundly impactful for people, whenever I think something is going to be controversial, whenever I think something is going to be very important, I always want to make sure I really work very hard at citing my work so that you can understand the core reasons behind it. Today's episode and the next series of episodes, I think I'm doing 5 on this. It's a lot. I'm doing it, and it's going to challenge a lot of people. It's going to trigger a lot of people. I know this to be true. My intent is really, I have one intent, and that is to be of service and to do a good job and to be clear and to be helpful. And I think when we are triggered by things, like, I just did this whole video where I talked about doing the dishes and self-silencing. That's my first intro to self-silencing. And that video got I think we're like 500,000 views on it. I want you to know, views don't drive me. It's the interactions that drive me. If I make a video and it has 500,000 views, but I want to do things that have value and meaning more than I want to do volume. And so when I read through your comments on that video, I know self-silencing is an issue. I know it's going to touch a nerve. So whenever I touch a nerve, I want to make sure I am being as pure as I can be with my material and with my with the facts that I bring to the table, and as compassionate as I can be. If you read through those comments with the reel that we did that was pulled out on self-silencing and me not doing dishes in the earliest part of my marriage, you're going to see a lot of people who are very angry in there. That doesn't bother me, having people give me negative feedback like that, and calling me names, or saying that she should have left me on the side of the road. And there's a lot of different things. People have said some interesting things. That doesn't get to me, because when someone comes to a place and they openly acknowledge something they've not done right, and they openly acknowledge what it did, and they are honest and open to trying to become better, that's what we want. No one's perfect. No one will be perfect. We all make mistakes. It's not the mistake, but it's whether you get up and continue working at it to become better. So when you see those responses being really mean and tearing things up, there's good ones in there too. You see the mean ones. What I want you to know is how I understand it is I see that as this is triggering people. These are women who this is happening to them. There's a lot of emotional overlay in here that is so important to communicate. And as anytime you talk to them, there's a lot of emotional charge, it's going to trigger emotions. I'm going to step into this space because I truly care. So let's get into it. When I first started practicing medicine, working with women, as I've said earlier, and I'll repeat it now, it all started with one case once with one woman, and I prescribed her progesterone. I was on a rotation in med school, and it was a rotation where I was doing environmental medicine, and she had mercury exposure, so we were treating that. She had emotional stuff, and the physician who was the physician overseeing me at that time, he, supervising physician, gave me free rein to figure out what I want to do with this, and so I did my homework, and I want to try progesterone because of her symptoms and the way her moods were shifting around her cycle. And it was such a powerful tool, and it was amazing. And I found that this is what I wanted to do. I want to have this impact. I want to help people with this. I want to help with anxiety. And so, stepping into that space and treating with just progesterone was wonderful in the very beginning. But, if you do this enough and you see enough patients, you realize it's not all just progesterone. And even when it is progesterone, it's still not just progesterone a lot of times. There's more to it. But the other thing you see with women, there's more to it. There's more to women. We're 80% of autoimmune cases are women. 80%. Women have higher rates of autoimmunity. Women have higher rates of cardiovascular disease and more mortality with cardiovascular disease. Women have higher rates of anxiety and depression. Women have high rates of a lot of these things. And in medicine, the science that we look at it through, that we learn in school and what's in the general literature, really does not embrace. Let me reverse this for a minute. Medicine doesn't fully account for the reasons why this affects women at such higher rates relative to men. Medicine misses that. And anybody who goes in the room who has half a brain is going to see this is happening to women a lot. And they're also going to see other patterns that are associated with it. That's the self-silencing that I want to get into. When I started interviewing these patients and seeing these women and being their physician, what I would find with their lab work is many of them would have cortisol irregularities. And, as a physician, when you see someone's cortisol being off and you see symptoms of stress, you want to do an interview. You want to get to the bottom of it. Well, why? Because that's what a doctor should do. When you go to your doctor's appointment, your doctor doesn't really talk to you about you. You just talk about the bare minimum. That doctor's just trying to get in and out of that room to make their quota, I guess. That sounded mean, but a lot of doctors are very restricted by insurance policies, very restricted by the place they work to keep a strict number of patients they see and keep numbers going a certain way to keep profitability. That is a fact. But I don't do that. I own my own practice. I can practice as I feel right. And what gives me my success is not always a number. It's the individual in the room with me. So when you're practicing medicine with women and you want to do a good job and the patient has all these symptoms and you see your cortisol being a little funky, you want to ask, what's going on? Are you not sleeping? And what's going on with your life? What's your stress levels like? This is when you start going down that rabbit hole. Because if you listen to them, you're going to start hearing the reasons why they don't do self-care. I got to take care of all these kids. I got my husband. I got to take care of this person. I got to do this. Or, a patient comes in and they're stressed about weight gain and they're really worried and frustrated by it. And again, cortisol's irregular, insulin is a little bit high, hemoglobin A1C is low. She's not overeating. All right, if she's overeating, hemoglobin A1C would be higher. So insulin's high, cortisol's low. That is a sign that a person is under significant stress causing them to gain weight. And so you sit down with this woman trying to understand them. And there's this sense of they feel like they need to look a certain way and they're strict with their diet and have all this stress around that. And in the very beginning of practice, that drew me to do more of my homework. And I came across the work by Dr. Jana Jack. She published some research late 80s and early 90s about self-silencing. I remember that was a very pivotal time in my life to read that and understand that about women. Because as a man, I never understood this. I never knew that. The things with women is that there's a societal and gender role expectations that you have. And they're placed upon you. And it's prioritizing the needs of others, having emotional control over yourself all the time, being just perfectly agreeable. Creation and maintenance of close relationships. You have to, maintain all the relationships, do all the work in there. And women are culturally rewarded for that silencing of the self, where they don't always vocalize what they're feeling or thinking. you know, you're rewarded for being pleasant, self-sacrificing, you know, or emotionally contained. The perfect ideal mom, you know. The thing is, like, when women are raised this way, it fosters an environment where it's difficult for them to say no, or difficult for them to vocalize what they need or want. Oftentimes they don't even know what they need or want because they've spent so much time focusing on other people's, they've never discovered what their dreams were. So how Dana Jack defined as self-silencing is formally defined as inhibiting self-expression, feelings, thoughts, or actions to avoid relationship conflict or loss. And further, it's a strategy used to maintain closeness or security in intimate relationships. Women are trained from a young age to believe that, you know, if they were to speak out or to do something, you know, against that, it would jeopardize their relationships. They would be alone. And they would be not valued. And so when a woman comes into clinic, and I'm going to stick with weight a little bit because that's a big one, weight gain. And again, I know they're not overeating. I see their A1C. They're not overeating. And I see their cortisol and I see their insulin. And I listen to them very clearly about their stress levels. And, you know, I think my second video I ever released on Instagram and on YouTube, I talked about this woman named Julie. It's a fictional character, but she isn't. She's an amalgam of all the women I've ever seen. I just went over this woman's life where it's, you know, she wakes up in the morning, you know, maybe she does a little bit of exercise to take care of herself, maybe, but usually she wakes up in the morning, you know, gets the kids dressed, you know, make sure they have their lunches packed, make sure they get some breakfast, make sure they get off on the bus. And she herself goes on to her job if she's working a job or at home, get everything together around the house, but she's working one way or the other. And then if she's working outside the house, you know, she's probably getting paid 60, 70 cents on the dollar relative to a guy doing the same amount of work. So she works a little bit harder. The average woman works a little bit harder than men do. And then statistically speaking, women put in more hours in a day than a man does with work between home and outside of the home work. Then they come home, they get the kids off the bus, bring the kids their after school activities, bring them home from the activities, make dinner, make sure they're doing their homework, have dinner, start doing dishes, make sure the kids get ready for bed, clean up, maybe watch a little bit of TV while they're folding laundry. You know, in that time, where was she? The thing is, you can do this. You know, your capability to do it up here, your ability to think to do it, and I can do this, it's amazing. But your body's capacity to do it is limited. The more you do this, the longer you push like this the more silencing the self there is, the more your body's going to respond, you know, different than what you want. And this is when women start to feel betrayed by their body. This is when I step in and I'm a part of the relationship. This is my first, you know, connection with the person, my first touch, my first contact. You know, they're not able to lose weight, or, you know, there's a host of other reasons why. But this is when, you know, silencing self has gone too far. You know, there's only so many times you can ignore yourself and press yourself so hard. Your cortisol levels will be high, then low, and over time very low. And now you're going to have higher insulin from this, and you're going to end up having, you know, weight gain disproportionate to your calorie intake. And that's going to cause you to be like, what's going on here? Or I'll cut my calories, or I'll try keto, or I'll try this, or I'll try that. And nothing works. Nothing works. Because we're not dealing with the core of it. So when they come into my clinic and I sit down with them and I go over their history, you know, again, I'm going to stick with the weight one a little bit more. But weight's not all of it. There's autoimmunity. I'm going to do a section on this for autoimmunity, how self-silencing triggers autoimmunity. I'm going to do one about fertility. I'm going to do one about carotid artery thickness and cardiovascular disease. I'm going to do one on depression. I have a long list of things and good research to share with you how self-silencing impacts these things. But again, sticking with weight, I can tell you what works well for weight loss in those women. There's a GLP-1 class of medications. Yes, that will work, but that's a one and done. No, you do it and you're going to be on the rest of your life unless we address these other issues. So what are the other issues? To get the weight down, to fix the insulin, and help them there, we do intermittent fasting, 18-hour fasts. You start with 12, you work your way up to 18. It takes time, but it can be done. We're careful of simple carbohydrates and grains, but I'm not going to do keto with them because that strains them sometimes too much too. Women will follow that directive until it doesn't work. Brendan, why wouldn't it work forever? Because we haven't dealt with the core reason behind it. This is where it gets sticky, and where sometimes this is traditionally when the patient turns on me. This doesn't love me. You see, if you were raised in a place where you rarely express your anger to those people close to you, if you were raised in a place where you assess your value by external standards pushed onto you by someone else, like how you look, how you appear, the value you bring to the other person, not just value because you're here. Think about this for a second. In a pure light for a moment, your child is born. There's your child. For those of you who have children, there's your child. You just love them. Oh, you just love them. You just love them. It's your baby. They don't have to do anything. You just love them. That's love. But it gets twisted around as we go through life to the point where it's like, it's no longer love because you're just there. It's love for what you can bring to that person, what you do for them. That's not really love. That's transactional, by the way. So if you're raised in that, and you're raised to believe that care is a self-sacrificing thing, the only way to show care is through self-sacrifice. If you're raised where you're never allowed to bring your true self to this space, and there's two parts of you, there's this angry part of you here that no one knows about, then there's the sweet part up front. Coming into a room with a doctor like me and having me poke at it by pointing it out, it can be that time when they turn on you as a physician. They get mad at you. No one wants to touch this. But, what we resist will persist. If the patient comes to my clinic and I say, okay, we do intermittent fasting and I'm going to test your labs in about a month to make sure that the insulin is going down and that your cortisol is getting better, I'm going to do this protocol, I'm going to approach it. And if they do that, that's great. But if they're not approaching it from the deeper points I'm pointing out, they'll have limited success, or they may not even come back. But what we resist will persist. And that's when the patient, if they didn't stay with me, if they took off for a while, they always come back. They always come back. But sometimes you have to wait till you're damaged enough, hurt enough. They may go to other doctors. Other doctors will give them, high dosing stimulants. They give them tons of high doses of thyroid. There's a lot of weird things people do. They try all these other things, these fads things, or maybe GLP-1s now. But it doesn't click, and no doctor ever really sat down with them and talked about this one thing, and deep down they knew this was what's going on. So they come back at some point because it gets serious. Some of the diseases associated with this that I'm going to bring out to you guys is like things like carotid atherosclerosis. That's a measurement of the thickness of your carotid arteries, the plaquing on the arteries there. Women who have higher levels of self-silencing have a higher level of carotid artery calcium. You have higher calcium scores, and you're going to see these women who have higher risk factors for heart attacks and mortality post-heart attacks. You see risk factors for infertility. You see just adds up with autoimmunity, with infertility, with PMS and PMDD. There's only so long they can deny it until they come in and we're broken at that point. And it's not easy when it gets to the point where she's ragged and she's hurt. And I've been in the room with women who had, mixed connective tissue disorder, where their fingers, they touch things. But there is hope. The things I do for the body and the endocrine system and the immune system and autoimmune, these things work. They do. I use labs to verify, and I do that. But they don't work long until we do the other part, which is the self-silencing. As a man, married, happily, I had to grow. And part of me growing, let me step back for a minute. I'm Gen X. I'm a child of the 60s. I remember this thing that was popular, this whole thing, like women can't change guys. When I started dating, it was a thing like, women shouldn't try to change men. It was just part of the cultural dialogue at the time. It was a long time ago. But I would argue that, we're supposed to change in relationships. That's what relationships are. So when I got married to my wife, I knew I wanted to change. As a man, I never understood self-silencing. I have learned so much over time. The thing is, when women are raised with this self-silencing, where they don't feel their voice is welcome, otherwise they'll lose everything, it's a terror inside of them. It takes a long time to unpack it, to feel safe, to unwind it. But as a husband in a marriage, as a girl dad, as a man that works with beautiful, brilliant women, just amazing women, talented, it's worth it. It's worth the effort. I've learned, as a man, that it's important to be in that space with them and let them know it's safe for them to talk about these feelings with me. I've learned to welcome them into that space with me and to let them share with me what it is that's going on. I mean, I've had it where in the very beginning of these relationships with some of the doctors I worked with, I remember this, they would get mad and they wouldn't really tell me. I didn't know why they were mad. And I didn't understand that part of them was terrified to really talk about it. The beauty and the unfolding of the relationships that I've had is because, we've created this place where we can talk to one another. I'm saying all this because I want you to know that it's possible to change, to move through this. Sometimes therapy is necessary, absolutely, because there's a lot of trauma women have gone through. You guys have more CPTSD, complex PTSD than men do. You have more PTSD than men do. Valid. And you self-silence way more than we do. True. And it really impacts your health. Therapy does work. But we shouldn't only rely on that. And not everyone has access to therapy. But you do have access to as men. Men. And as a man, I will tell you that it has been one of the most important things I've ever done in my life is to understand self-silencing for the women in my life and be there for them. And for me to grow and change and understand this and welcome their voice. If not, seek their voice, actively seek it. And then show them how safe it is to communicate with me. That episode that everyone got crazy over when I didn't do dishes for a little bit. It's true. I should get in trouble for not doing dishes, but you guys, I'm not evil, okay? I'm not evil. I'm just a flawed person who grew up, and that's okay. But that self-silencing on my wife's part that was how I started really understanding it and knowing what I wanted from my marriage and from my relationships with the women in my life. This next series is very important to me because I'm going to discuss with you the metabolic pathways that are involved with autoimmunity and self-silencing. I'm going to talk to you about the immunopathways, the endocrine pathways. I'm going to go through all of that. I'm going to do it with fertility. I'm going to talk about associations with depression. Talk about it with PMS. I'm going to just keep going through, and coronary artery disease. I'm just going to keep going. I have a lot of material. I'm excited to do it. To the degree it's helpful, press like. If you enjoy the material that's here, please subscribe. And if you think this will help someone, please share it. Your comments mean everything, and we do read them. I am biased towards Instagram because it seems to be where it's easier for me to catch up, and we have a lot more following there, a lot more traction there, so I see more of the comments there. But I do look at YouTube, and I do look there. I've not been on TikTok in years. I just don't have as much time, but I do look for you. You are always welcome to comment things, and even when they're spicy, I can take it. I'm not here to feel good. I'm here to do good. And to the degree I'm doing it, I'm happy. So it's okay if you write something spicy that you're upset about something. I'm okay. And you have every right to. You need to vocalize it. I want you to share those things. I want you to feel safe to talk about what you're going through. To the degree you feel safe doing it on a huge platform. That's crazy. You're right. It's a big public platform. But those of you who do share those things, please feel safe. Please feel safe. It's welcome. You're welcome to do that. So thank you very much. And I'll see you at the next episode.